there, it's nice to meet you. My name is Justine. I'm your student midwife today. So my chart indicates that you're here for some urinary tract infection symptoms and some vaginal discharge. Can you tell me about that vaginal discharge? What color is it? And is it thick or thin kind of discharge? Is it curdy? Okay, so a greenish, thinnish kind of discharge. And have you noticed that there's any odor in that discharge? A fishy smell that's worse after sex? Okay. And any pain with intercourse at all? Yes. Okay. And can you tell me about your partner or partners? How many sexual partners do you have, and are they male or are they female? You're married and have one male partner. Okay. Any new partners recently? No. Okay. So based on your symptoms that you described to me and the tests that we have run, you were negative for bacterial vaginosis and you were negative for yeast infection, and your urine was okay too. Your sample under the microscope is showing what is called trichomonas. Sometimes it's called trick for short. It's a very common sexually transmitted disease. Actually, it's the most common treatable STD, and it's caused by infection of a microscopic protozoan parasite called Trichomonas vaginalis. So that parasite passes from one person to another during sex. I want you to understand that everything we talk about today is confidential, and the more information I know about you and your situation, the more that I can help you with treating your health concerns. You don't have to be embarrassed, and everything you say is absolutely confidential. It stays within the office. We only use your health information for health purposes. We don't share it with anyone. So is it possible that you or your partner have had other recent sex partners? That's okay. I understand why you didn't want to mention it before. So when did you have sex with this other recent sex partner? Within the last week? Okay, thank you for sharing that with me. So it's going to be important for you to have a conversation with all of your partners, and they're going to need to be treated because men can also get this trick. Some people carry it without even having symptoms, so even if they don't have those symptoms, they still could have it too. And infected people without symptoms can still pass that infection on to others as well. So without treatment, the infection can last for months or even years, and you could be reinfected if your partners are not treated and you guys have sex again, even if you're treated, because you can get it again. I realize this may not be an easy conversation to have with your husband if he's unaware of this other partner, but it really is important that everyone that you've had sexual contact with be tested and treated. Your partners can go to their primary care physician or the local health department, and they can be tested and treated. I also can refer you to a counselor if you would prefer to have that conversation with your partners with someone who can help you and your partners kind of work through this. Without treatment, the infection can last for months or even years. So tell me, what questions do you have or what concerns do you have so far? Does that all make sense? I know this is a lot to take in at once. Let's take it one step at a time, and first let's talk about how we can treat you. So trick can be treated with an oral medication. You only have to take one dose. And do you have any allergies or are you on any other medications? No? Okay. So I will send a prescription then for tinidazole, and that's 2 grams, and you take it by mouth, and I can call it into your preferred pharmacy. If this medication is not covered by your insurance or if it's too expensive, we have another med that we can call in instead. Both of these medications you would only have to take once. And you also should know that you really shouldn't drink alcohol within 3 days after taking this medication because they can really negatively interact. So that's super important. And the most common side effects that you might notice with this medication is a metallic kind of bitter taste in your mouth. Other side effects, a little bit less common, but you can experience weakness, dizziness, gastrointestinal issues such as nausea, constipation, indigestion, vomiting, and sometimes a loss of appetite. But some people don't have any issue with it at all. Usually the most common is that metallic taste in the mouth. Do you have any questions about how we will treat this? No? Okay. So you will need to wait to have sex again until all of your symptoms go away, or usually that's about a week after treatment. You'll want to make sure that your partners are treated and also wait about a week, same thing with them, to resume sex, so that way you don't get reinfected. And if they're having sex partners as well, other sex partners, those partners are going to need treated too if they have trick. You can come in to be checked again if your symptoms ever come back. And with your permission, I would also like to screen you for other sexually transmitted infections as well, just to make sure there's nothing else going on, just because you've had a new partner. And we found the trick, but it would be important to screen for other things as well, because we know sometimes there can be more than one infection. I would like to follow up with you and have an appointment to retest for the trick within 3 months or less. And we just want to retest to make sure that it has gone away and that you have not been reinfected. And you can come back sooner, like I said, if your symptoms go away and then come back for some reason. You can come back in and we can see you again. So tell me, what questions can I answer for you?